Hi, I'm Neil Argyle, and I'd like to welcome all of you to everyone's favorite game show, Would You Send This Patient Home? We'd like to welcome back today our returning champion, Dr. Draper. It's nice to have you here with us today. And we've got a newcomer in our midst today, Dr. Michael Lamers. Okay, he's the new kid on the block. He's trying to steal away the thunder of the Draper. So we have a lot of questions, a lot of things for us to go through today, but we're really looking forward to today's challenge. So I'd like to get started. Our first patient is a young woman. This is a 29-year-old. She presents with chest pain. She says that it's primarily located right behind her sternum. It's associated with eating, mostly with spicy foods or chocolate. She says that she's only having it after she eats her meals, and she's currently afebrile, normotensive. Her heart rate is also normal. She has no history of any significant illnesses, and all of her labs are normal. So, would you send that patient home?
Clearly the presentation of this 29-year-old is acute coronary syndrome. Her pain, her symptoms, her risk factors, she's a woman. I think clearly she needs to stay.
No, I'm very sorry. That's actually incorrect. Dr. Draper?
Probably the best diagnostic test for her is to send her home. If she had a heart attack, we'll find out about it. Besides, it would make a good, interesting clinical case when she comes back.
That's actually correct. Thank you very much. You would send that patient home. We have our second patient today. This is a little bit of an unusual case. We have a 72-year-old male, veteran, who presents with shortness of breath, a heart rate of 140. His blood pressure is 60/40. He presents obtunded, altered mental status, doesn't know where he is, who he is, has a white count of 25. He has a sodium of 120. He has a potassium of 8, and his troponin is 4. Now, would you send that patient home? Dr. Lamers, your response?
Obviously this patient is septic with the elevated lactic acid level, hypotension, and elevated white blood cell count. Clearly needs to stay.
I'm sorry, Dr. Lamers, that is actually incorrect. You could potentially send this patient home.
Who gives the answers to these damn questions anyways?
Who makes up these answers? I do. Who else would it be? Dr. Draper?
He sounds pretty old. I like to make people relatively comfortable, so if we have enough Vicodin, we can send him home.
That's correct. You would send this patient home. Our third patient today. This is a 29-year-old Peruvian gentleman who, while working, develops the sudden onset of excruciating flank pain. He presents to the emergency room with fever, chills, sweats, a blood pressure of 140/80, a heart rate of 110, a temperature of 102. He says that his pain is not relieved by any of the IV morphine that he's giving, and he's asking for Dilaudid. He lives with 2 women, both doctors, and he has no other medical problems that he knows of and is on no medications. Would you send this patient home?
Clearly the gentleman with kidney stones needs to stay. This is intense pain. It's requiring regular Dilaudid bolusing. He needs to stay in the hospital.
I'm sorry, that was not the answer we were looking for. Dr. Draper?
Well, sounds like maybe he has a stone, but you know, it doesn't make much difference what we do. Those stones either come out or they don't, and it's a good diagnostic test. Does he have transportation? I'd send him home.
That's correct. Once again, Dr. Draper, we would send that patient home. So, what do you win today? You win your very own copy of a Bill Blod painting.
Does this one have skulls in it?
Yes, it does. It does have a skull art. Why wouldn't it? We'd like to congratulate our champion and still champion, yet again, our highest earning champion of all time, Dr. Draper. Congratulations. You've won yet another game of Would You Send This Patient Home? Once again, I'm your host, Neil Argyle, and I'd like to thank you for tuning in today. Thank you.
Dr. Christopher, we better get going. It's time for morning report.
All right, let's hustle.
Where are you guys going?
Back to the VA. Remember that one time we got that bad batch of Ambien?
Mm-hmm.
Dr. Renee?
Hey.
There's a patient down in 322, Mr. Smith. Tried giving him some Ambien and he's just going crazy. Do you think that there's something that we can give him to help him sleep tonight?
I know just the thing.
Hey, is that Dr. Smith again?
Huh. Yeah. Dr. Smith also likes to search for fossils around these parts too. About 1982, he found at the end of the rainbow this big pot of gold, and since then, Dr. Cusack's been on faculty.
Okay, so Andrea, let's start off with the admissions that you had last night.
Okay, well, there was one 22-year-old with GERD admitted for roulette MI, another guy for placement, another 30-year-old for placement, CT-guided lung biopsy. We have another chest pain, the guy that I'm going to talk about.
All right, well, it sounds like you had a busy night. I'm sure that kept you plenty busy, and I'm sure James was up all night. All right, so let's talk about your case then.
So this is a 69-year-old guy coming in with a 4-day history of somnolence and confusion.
Perfect. So also, what's his past medical history?
He has a cancer of unknown primary, heart disease, erectile dysfunction, COPD, right-handedness, negative PPD, 5 cataract surgeries, 25 bypasses.
Okay,
Does he have lumbago?
Chronic back pain.
And was his problem list significant for health maintenance exam?
Well, you know, I couldn't find it on there, but when I went back through 25,000 clinic notes, I was able to find that.
How about knowledge deficit?
No, it was actually brain disorder, NOS.
How does he learn best? By seeing, doing, or
When I was
by
sitting in my
listening?
clinic room,
Yeah.
and they were asking him in the hallway, I overheard the nurse saying that he does better with learning by reading.
Did he get diagnosed with that right-handedness by echo?
It was a MIBI.
Okay. Nelson?
So we moved on to exam. Okay, yes, no, maybe a little bit, no.
Okay. All right, let me get that up here on the board. So just keep going. I'll start writing.
When he looks at things that are straight, like the corner of the wall or the table, is it straight or is it curvy?
He's somnolent. He can't answer that.
Has his wife noticed that he's been complaining of pain with eye movement, or
She didn't ask him. He was too sleepy.
how about eye grittiness or dryness, blurring, anything like that?
I don't know if anybody saw, but on Quantum MD the other day they had
this case presentation done by Mark Matrana about this 64-year-old guy went to Papua New Guinea, ate a monkey brain. It was pretty interesting.
Is that the one where he had pheochromocytoma?
That was a different one. But seriously, any patient who comes in with altered mental status, let's start thinking about pheo. Did you get urine metanephrines or plasma metanephrines?
It's pending.
Key part of history. Pheo.
When you held something bright red up to, and he covered one eye, did he notice any blanching of the red color?
Negatron.
How about any rotary nystagmus or endpoint nystagmus?
Seriously?
Now, do we have imaging? Could we have Ashish take a look at the imaging?
Oh yeah, there's a really great X-ray. Should we just bring it up, Ashish? Do you want to take a look at it? You're a budding radiologist.
Ashish.
It's an X-ray. It's just an X-ray.
Yeah. Okay. So let's do that differential real quick. Okay. So first thing.
Pseudotumor cerebri.
Okay. Pseudotumor.
Adam mentioned pheo. Pheo is always a good thought in something like this.
Okay. Pheo. Great. Great. Cranial Pott's disease. Cranial Pott's. I like that.
Well, you always have to think of Erdheim-Chester disease, also known as polyostotic sclerosing non-Langerhans cell histiocytosis. Of course, tertiary syphilis, a case like this. Pseudo hyponatremia.
I think that's an excellent point. Okay. Anything else on our differential? We'd like to welcome Ashish back. Thank you so much for reading that X-ray.
Oh yeah, thank you.
Okay. Anything else?
So do you want to know the final diagnosis?
Yeah.
Yeah, he just overdosed on his Percocet. He just knew a little Narcan.
Tough case.
Yeah.
Okay,
It
yeah.
was really hard. It was really
Yeah,
hard.
we didn't even think